Humanitarian Broadcast.
Welcome back. You tuned into Salam Media, and we are speaking to Dr. Herman Edeling with regard to the vaccine. And yes, we're about to round up. Doctor was giving us a second response to my question in terms of why is there no healthy academic discussion regarding the safety and effectiveness of the vaccine. Doctor, you can go ahead and then we can wrap up.
Thank you, Miriam. I think I concluded my remarks about that. I cannot say why there isn't that debate. The debate is prevented by those in authority. Why those in authority want to prevent the debate, I cannot say, and I think you should ask them, because I think it is the right of the citizens of South Africa for the authorities to allow open and uncensored, healthy debate and discussion between scientists, doctors, and members of the public. The other element of the question that you posed before the break was about the rationality of mandated vaccination for certain employees of companies and vaccine passports, etc. And the simple answer is that it is totally irrational, because the only purpose that there could reasonably be for mandating vaccination of employees of a company would be that those who are vaccinated won't transmit the illness to other people at work. But we know that that doesn't work, because the vaccination doesn't protect you from catching, carrying, or transmitting the virus. It only protects you from severe illness and death. So my vaccination does not protect you. It only protects me, and as I said, in a limited way and for a limited time. So if I don't want to be vaccinated and I'm the only person who's going to potentially not be protected, surely that's my business. And surely it's my business to weigh up my risk of having the vaccine, because there are considerable risks, against the potential benefit for a certain period of time from having the vaccine. But because my vaccination does not protect the other people with whom I come into contact, it is utterly irrational to demand or mandate vaccination in the so-called interests of other people. Thank you.
Thank you, Dr. Herman Edeling, and thank you for empowering us and giving us your medical evidence based on your research globally in terms of the type of vaccine, in terms of research, and that. So having a good academic debate. And as I mentioned earlier, you are quoted as saying you are excited about the science, and you're rooting for the science to work eventually, because not only for COVID, but for other types of illnesses and diseases as well. So it's new technology, but you're hopeful, but you're saying it needs to be tried and tested and verified, as we do with every, whether it's a drug, whether it's a vaccine, with everything. Science should go about it as a normal discuss, as scientists were doing from time immemorial, in terms of proving a safety and effectiveness of any drug that is brought into the public domain.
Yes, absolutely, Mariam. And in closing, even more so because of the fact that there are cheap, effective, and safe ways of preventing COVID and of treating COVID. Those are summarized in my good news document, which is attached to the letter to the president, and sets out there are very effective ways of preventing the illness. And if one gets the illness, there are very effective ways of treating it. So there is not actually an emergency that requires people to take the risk of vaccination with an untested scientific development.
Thank you. It's much appreciated. And thank you for your time, and much appreciated. And hopefully we can talk to you again in the future in terms of the treatment that you alluded to now, in terms of safe, effective to treat COVID currently. Thank you for being our guest, and go well, Dr. Herman Edeling. Good afternoon.
Thank you very much. Goodbye.
We're going to go for a short break, and then we're going to be talking about support for female entrepreneurship. All this after the break.